Hello everybody, this is Dr.Sharayu and welcome to my YouTube channel. In today's video, I'll be talking about PCOD or PCOS, that is Polycystic Ovarian Syndrome or Polycystic Ovarian Disease. It is very common amongst females, and if you're a guy and you're watching this video, please do share it with your female friends so that they also get to know about what are the do's and don'ts and the loopholes of preventing PCOS. Okay, so now we move on. Now, causes of PCOD, PCOS medically are many, but the most important one that I will discuss today from homeopathic point of view as well is stress, and also the family history. If your mother or your grandmother, your sister is having PCOD or PCOS, hormonal imbalance or any kind of functional disturbances in your body is closely related to the mind, and I strongly believe in it. And I've seen so many cases where any kind of functional disturbance, now what functional disturbances can be, like acidity, like headaches, like some kind of stress tension induced feelings, like someone says I'm not feeling well, or someone says that I'm constipated, my bowels are constipated, or my breathing has become shallow, or I can feel some kind of pain in the chest or in the back, or PCOD symptoms where the periods are irregular. Any kind of functional disturbance is a result of some suppression on the level of mind, where mind is not allowed to express itself quite freely. So, PCOS or PCOD is where your ovaries, I hope you all know the normal structure of the female reproductive system as it is displayed here. So, the ovaries start forming cyst, they become cystic, okay, and this causes some kind of changes in your hormone levels. Now, these hormones, which are very necessary to achieve a peak level and to drop down at certain days of your menstrual cycle, which will cause bleeding, doesn't get coordinated. The system becomes disturbed. Now, the most important, as I said, is stress or suppression at the mind level. Also, the WHO theme this year was like depression and stress. So, it has become like everywhere there is an outburst of some kind of mental suppression. Now, excess of anything, excess of expression or excess of suppression at your mind level is extremely detrimental for your health, especially women from puberty onwards, those who have suppressed their emotions, those who are undergoing a lot of stress, that may be academically, that may be socially, it may be anything. Also, I see that people exercise a lot and there are people who do not exercise a lot. So extremes of anything is going to cause hormonal changes, which is going to lead to PCOD. And today we are living in so much of pollution and everything around us that already, the physical stress on your body is a lot. Your body is dealing with a lot of things. And plus, when you are internally not being happy, not being adapted to the stress around, you are going to suffer from some kind of the disease. Now, especially, I've seen girls, those who do not take their puberty well. Okay, so once their periods start, there are hormonal changes, obviously, which are supposed to happen at that particular age, but they do not adjust with those changes. So there is sudden fits of anger, there is sudden depression, melancholy, highs and lows in their mood. Eating is very bad, eating junk food, no exercise, or a lot of exercise where they deprive their body from eating good food, they deprive themselves, they starve, So all these things are going to cause PCOD. Now, what are the things that you must take care if you're already suffering from PCOD? So before we move on to that, please go ahead and like this video and also hit the subscribe button. I'm Dr. Sharayu, owner and prime consultant at Dr.Sharayu's Homeo Care. I consult in Mumbai and Pune, and also you can go ahead and search me on Facebook and hit a like on my Facebook page at www.facebook.com/Sharayu for health. So go ahead, hit likes, and now we move on to the video. Okay, now we move on to the kind of preventive measures that I'm going to discuss. First, those who are having PCOD or who want to prevent themselves from getting PCOD, we'll be talking on those terms. Okay, first and the most important, eat good food. Now, good food doesn't mean rich food, rich in terms of nutrition. Okay, so not fat rich food, not carbs rich food, but it should be very balanced food. Eat healthy food. Now, anything that you're putting inside your body is going to be the only source of energy for you. Energy as well as nutrition. So that needs to be correct. Input, if is good, only then your output, that is your working capacity, your concentration, your body level activities are going to be directed in the right direction. So eating good food. Second one is exercise. All the normal discharges of your body should be regulated. All the normal discharges from head to toe. Eyes, that is tears, your perspiration, your also periods, your urine, your bowels, everything needs to be regulated. And only when the normal discharges are thrown out of your body in the right amount at the right time, it means your body is functioning at its optimum level. So input is very important. When your input is good, your results are amazing. Okay, so that was about your food. Next is exercising. Exercising is very important, as I said, for perspiration. Naturally throwing out the sweat is very important. I'm talking in very lay terms so that all of you understand it better and you start taking care of yourself. So perspiration, your sweat glands needs to function correctly. I see people, those who do not sweat a lot or who don't get sweat at all. So that individualization is different, but the optimum functioning of your body is very important. After sweat, after perspiration, after exercise, the very important note over here is if you're already suffering from PCOD, you have cystic ovaries, please do not perform a lot of abdominal exercises. Okay? That is because there are girls, I know it's such a big misconception. They think that if they are not getting their periods and if they start doing abdominal exercises like a lot of crunches, then they might get their periods. Please do not do this, because if you're having cystic ovaries, it might rupture if you're doing a lot of stressful abdominal exercises. So do not target your abdomen if you are having PCOD. You can do a good cardio. If you want to do resistance exercises, you can do it for lower limbs or your upper arms, but do not concentrate a lot of exercise on your abs. Let your periods regulate, let PCOD reduce, then you can slowly start doing it. But do not target your abdomen, because if the ovaries rupture, it is going to be a very bad condition. Okay, so please do take care of that and do not even give such advices to people without knowing the science behind it. Okay. Next, after exercise, I would like to say that drinking water is very important for thermoregulation. So, drinking correct amount of water, that is around 3 2.5 to 3 liters of water per day. As I always suggest, keeping your system clean, your bowels clean. So all the natural excretions, your bowels, if they're constipated, I've seen many PCOD girls suffering from constipation. It is like a must. They have acne along the jawline. Now, acne, all these are like so interlinked. If you're having PCOD and you're taking separate treatment for acne, separate treatment for constipation, and a separate treatment for your periods, it is going to lead you nowhere. It is all going to become a mess, and you are just abusing your body with a lot of chemicals. After all, medicines are what? Chemicals. So, chemicals in the right amount, that is, medicines in the right amount, and having a correct line of treatment is very important. And medicines are going to act 50%, and 50% is what you give as a patient. How much efforts do you give for your own body is very important. So keeping your bowels clear, that is, eating fiber-rich food, exercising in the morning, having plenty of water, lukewarm water in the morning, is very important. Next, I see people having a lot of alcohol and smoking these days. Smoking and alcohol does affect your skin, which can cause a lot of acne again. There are other bad effects also, which I will not discuss in this video, as I'm talking from menstruation point of view. So that is again going to increase your acne. So reducing all this or avoiding all this is going to be the best option for those who are suffering from PCOD or those who want to prevent PCOD. Okay. So these are very important guidelines. Next, I see hair fall in PCOD. PCOD is one of the most common thing which is going to cause hair fall. Now, local application of anything in the head, applying eggs, applying mehendi, applying anything, henna, amla stuff, mixing it together, it is not going to prevent your hair fall, because the disease is internal, it's inside. Your hormones are not correct, and just locally applying stuff is not going to do anything. Hair is your exoskeleton. Exoskeleton is just like bones, skeletal structure of your body, which is inside your body. Hair is a skeleton which is outside your body, just like nails and hair. So if you're doing some treatment locally, is not going to help nourish it. Okay, so everything that you want to provide to your hair is going to be through the blood. So as again it goes back to eating correct food, taking right medicines, and following your regimen. Homeopathy has amazing results for PCOD. And I myself have seen people, girls, those who haven't got their periods for like 6-7 months, those who are suffering from lower backache, heaviness of their lower abdomen, and they start getting boils also on their body, excess of hormonal imbalance, have started getting their periods with homeopathic treatment and with correct approach towards health, following all the advices given by the physician. So all these were the guidelines for you girls. Go ahead, have a healthy life and a very balanced life, because after all, the quality of life is determined by the quality of your health. So take care, have a lovely day, have a lovely life. Bye bye, and stay tuned for more videos and hit the bell icon so that you get notified whenever I make a new video.